Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center. Today is Tuesday, October 6th. All right, Fred, let's jump into some COVID numbers. First graph is the 8 counties of the capital region. We currently sit at 21 people being treated. Now, we have our regional call tomorrow, so we'll hear what's going on at the other hospitals. As we're going to hear in a moment, we see our numbers going up a little bit, so the county numbers are interesting.
That's right. They have gone up a little bit, as you're about to show.
All right, but so far, at least on this graph, we're at 21. Next graph is admissions and discharges to the medical center. So this is what I was referring to. Above the horizontal line are people who come into the hospital. Below are the people who are discharged. You can see over the last couple days, we've had about 4 or 5 come in on a couple different days.
That's right.
And no discharges. And so if we go to the next graph here, you see what currently exists inside the medical center this morning. We have 12. We have 7 on the floor, 5 in the ICU, 1 on a ventilator. Now again, 12 is, we've been as high as 80. So 12 is still on the lower side, but we've also been as low as 5.
That's right.
So we're seeing that number trending up. We're going to watch it very carefully.
Yeah, we're going to watch it really closely, Dennis. Yeah. You know, the numbers in the community haven't really risen that much. My suspicion is tomorrow when we talk to the other folks that, you know, they probably haven't seen exactly what we've seen.
Yeah. Now, Fred, you recently spoke to the CEO of the hospital down in Queens, or the medical director down in Queens. This is the hospital that sent us the transfers early in the summer. Dennis. What's going on down there?
So, you know, Dennis, we really helped them out when we took patients as a region from Queens, from both Jamaica and Flushing Hospital. So I thought I'd reach out just to see what's going on. If you've been following the news, there's a bit of an upsurge in cases down in both those boroughs. So they've seen a little bit of an uptick, still manageable. They're admitting a few patients a day, but they're able to handle it. They are worried, and we may hear from them again if things get worse down there. But right now, just a kind of a slow, small rise.
If they reached out to us in the future and said they have more patients than they can handle, what's your opinion on whether or not we would take those patients?
Dennis, if we have the capacity to care for those patients, like any other institution in the region that calls us to take care of patients, we would take care of those patients.
Yeah, I certainly agree with that. Met with Mike Hauk recently. Mike is the analytic genius behind all these graphs that we look at.
Yes.
And Mike has actually now created one for influenza as well as the other virus we talked about, RSV. And so in the near future, if we start to see influenza cases here, we're going to start showing those graphs as well. So we know which of the activity on this campus is COVID, what is flu, what is other viruses.
You know, what's going to happen this fall with respiratory season could be a little confusing with the multiple different viruses out there with different outcomes. So this is going to be incredibly helpful for us to understand where we're going.
Absolutely. Before we move off COVID, Fred, give us an update on supplies. We've talked in the past about PPE and ways to wash our hands and masks. Are we okay with supplies today?
We are, Dennis. You know, masks, gowns, wipes, all of it. The supply folks have been doing a tremendous job getting stuff for us. So we're in a good shape.
All right, very good. Let's shift gears. Let's talk a little bit about facilities and buildings. Fred, when you were president of the faculty practice, you brought into the organization Community Endocrine, which is a very large, I think it's one of the largest endocrine groups in the country.
Yes.
And they currently were working out of 1365 Washington Ave, but there was an opportunity to move them to a newer space, a better space, and I think we have an update on that.
That's right, Dennis. We were able to actually purchase a building. It's 220 Washington Avenue Extension. So actually it's pretty close to our IMG and allergy practice. It's a little further down on the Washington Avenue Extension. And basically what we did was we gutted the building and started from scratch from the studs in. And I have to tell you, I walked through it last week. It's absolutely beautiful. It's extraordinarily well laid out. The flow is going to be terrific. Physician offices on the perimeter, the exam space in the middle, nice laboratory area. And that group has a fairly significant research presence. And so there's very nice research space for them to do their clinical trials. And Dennis, probably most importantly,
parking.
Great parking.
For sure. So easy in, easy out, going to be great. And when do they occupy that space?
November. So we're getting close.
A lot of people made that happen, so congratulations to them.
Thank you all.
We talked in the past about how one of the great things about this video is we get to use it as a way to recognize members of our workforce, there's a couple things that we'd like to call out: the Daisy Award winner every month and the Eye Care Award winner. So compassion, accountability, respect, and engagement. And this month was a colleague of mine from the emergency department, Pam Young.
Congratulations, Pam.
Pam's a physician assistant. She's been here for many years. She's a great physician assistant, and we congratulate her as well.
She's also the representative of that group on MedExec.
Yes, she is. So she's interested in clinical work, but she's also been more involved in administrative work recently and represents her professionals in a great way. Last week we mentioned one of our signature events, our radiothon to benefit the Bernard and Millie Duker Children's Hospital and the Children's Miracle Network. And Fred, the number is incredible. It's just north of $274,000.
Just a tremendous effort. Many volunteers from our staff. I think over 100 volunteers to run that.
You answered phones?
I walked through and I was the cheerleader.
Okay, well you were there though, but you were there.
I
knew you were
answer
there.
Phones,
yeah.
But I watched people do it. They did a tremendous job.
Yeah, they did. Lori Kirch, who leads that team, did a wonderful job, and we thank her and her group as well, and all the volunteers who are down there making that happen. So thank you very much. Last topic we want to talk about is the current status of the union negotiations. As we've talked about recently, New York State Nurses Association has noticed that they have authorization to strike. So let's state a couple facts first of all. We've not received any notification to strike yet.
That's right, Dennis, we have not.
If we did receive such a notification, we would get a minimum of 10 days to prepare for a strike.
Yes.
But we do know that recently there's been some increased activity. The medical center, in particular, continues to negotiate in good faith at the bargaining table, and there is another session scheduled for next Tuesday. Fred, this is one of those areas where nurses who work at Albany Medical Center sometimes hear different bits of information. We thought it was incredibly important that we give them what we call the facts related to their rights as a nurse and their right to work if there is a strike. And I think there's some information we want to tell them about that.
That's right, Dennis. We actually created a series of FAQs which talk about their rights, both as a union member and as it relates to to a strike notice. So that's been widely publicized, perhaps not as much as we could, and we're going to do more of that. The nurse managers on the wards actually have that, and we had a meeting today to talk about them actually communicating very directly to all of you, to all of our staff nurses, so you know what your rights are.
And one of those rights is that if you are a nurse and you do not want to strike and you want to work that day, and if you're concerned that you might be fined by the union for working, you have a right today to resign from the union. And even if you never signed a membership card and you want to be certain that you say you don't want to be in the union, there's a way to do that. That's in those FAQs. But we would encourage you to talk to your nurse manager so you can go over the process with you.
Look for those FAQs. If you have any questions at all, look for those FAQs and sit and talk to your nurse manager. Let them explain to you those answers.
And we have done a video and an FAQ, and we'll make sure that we link both of those to this video here. And I think it's important, and I know, Fred, you agree with this, we respect all of our nurses at Albany Med.
Absolutely.
We respect their legal rights, and we specifically respect the legal right of nurses to work if, in fact, there's a strike. And for those who would want to work that day, we want to be sure they know how they would do that.
That's right.
All right.
I would say one more thing about this, Dennis, and perhaps this is for the community that might be watching this video. Even if there is a strike here at Albany Medical Center, we will be prepared to still provide all the care you need. We will be prepared.
That's a great point. Thank you, Fred, for making that. Okay, so we'll be back again on Thursday with an update. Very good. We'll be back again then. That will do it for today. We ask that you once again, please take care of yourself, take care of each other, and we'll see you in 2 days.